So here we are about to do the kinesiological muscle tests, and as we explained earlier, the difference between the Kendall and Kendall strength tests and Dr Goodhart's research on kinesiological muscle testing is to test the postural and neural activity of the muscles. So to do that we approximate the origin and insertion of the muscle and then just test to see if it can posturally hold. So it's quite a light test, quite a subtle test, and that's the art of, or the skill of muscle testing. The psoas muscle, again, one of the very important postural muscles that we showed earlier, that if it's misaligned it can rotate and side bend the spine. It's also attached to the annular disc fibres of the vertebra, the 5 vertebrae here, and that can actually go into spasm and pull the disc forward, giving a protrusion of a disc or a slip disc, which is commonly known. So to do that we raise the leg, again approximating the origin to the insertion, angle it at about 30 degrees up, and press down on lateral, and that's the test. This test is to test the Latissimus dorsi, again this very important postural muscle that immediately alerts the limbic brain of any misarrangement of the sacroiliac junction here. So it's very, very vertically aligned, vertical competent muscle. So it's very important to test it correctly. We keep the arm very straight. We don't want to recruit the biceps or the coracobrachialis muscle. So we lock the arm straight, turn the palm away from the body, approximate our fingers in between, stabilise the shoulder, feeling for any recruitment that takes place, because the muscles will try and help each other out. So we don't want any recruitment taking place. And the action is just to pull the arm away from the body like so. If it's strong, you'd feel the stability in there, and that tests the stability of the Latissimus dorsi. As we move down the body, we have the piriformis. The piriformis is one of the postural set again, and we'll try to level the pelvis. If the sacroiliac joint is compromised, the psoas will try to help with that compromise, the Latissimus dorsi tries to help with that compromise in the neck muscles, and the piriformis tries to pull laterally on the pelvis to stabilise it. Quite often if you get hold of the piriformis, and you'll find this one moves up and down easily, if it's compromised this would be totally tight, and there's a muscle underneath here called the glomerulus, and the sciatic nerve actually passes between the two, and quite often this action of the pull on the piriformis can scissor action the sciatic nerve and give classical sciatic symptoms, but is not a true sciatica, which is inflammation of the sciatic nerve. And below that we have the gastrocnemius group, which comes down and has its insertion way down here on the calcaneum, and the heel tension here actually alerts any bodily changes right up to the atlas at the top of the head. When we talk about pitch, roll and yaw, it's very important on the head positioning, so this is a very important postural muscle as well. When the person stood still, the gastrocnemius muscle is the one with the most proprioception on neural activity to the brain to tell us where we are when we're standing still. The second we move, the inner ear starts to take over, the vestibular reflex takes over. So this is a very important postural muscle when we're stood still. He's a very important muscle, part of the postural set, and this one's called the sternocleidomastoid, and it comes off the sternum and the clavicle and comes up and has a split tendon coming onto the back of the occiput here and onto the mastoid portion of the temporal bone. So we isolate the muscle by itself. As you can see, that muscle is standing out now, and we press down very lightly, and that would test the sternocleidomastoid. We have the upper trapezius, part of the trapezius group, and this one inserts right up onto the occiput. So we turn the head slightly away from the test, we approximate the head to the same ipsilateral shoulder, we stabilise on the shoulder, we stabilise on the head, and the attempt is to push the head back to the midline. So the test would look like that, and that's the range, and there's the test for the upper trapezius, and that completes our postural set.